Greetings, everybody. This is Dr. Weaver, and I am going to do a voiceover on diseases that impacts the eye. This actually, I'm starting on, I believe, slide 22. I think, so this is where you will begin, and of course, we will talk about the initial piece of diseases affecting, I believe, the ear in class. But again, I do these voiceovers sometimes because my schedule and all the things that are going on may not permit me to actually, um, do a full or complete discussion in the class. What I would like for you guys to do before you actually begin listening to this voiceover, I do have a link, a YouTube link at the bottom of the nurse's notes, or my not nurse's notes, of the speaker notes in the PowerPoint presentation. It's about 3 minutes, or maybe close to 4 minutes. Anyway, it's a great video that explains glaucoma. It explains the two types: the angle closure glaucoma and the open angle or chronic glaucoma, or what is considered chronic. And so take a listen to that first, take a look at that first, and then come back and listen to me. And that way you'll get a much better idea as to what this is all about. All right. So let me go ahead and I want to actually increase the size of that. All right. So as far as the ophthalmic preparations, when we're talking about ophthalmic, we're talking about the eyes, all right, and the different drug treatments, if you will, that are employed to manage these conditions. So there are various types of preparations that are used in treating these ophthalmic or eye disorders, such as glaucoma, in order to lower the intraocular pressure. That is the pressure within the eye that tends to be increased in glaucoma. It's the aqueous humor fluid that is building up in the anterior portion of the eye. Um, and it just can't drain properly or normally, and therefore that fluid it backs up and it increases the pressure in the eye. Hence, the increased ocular pressure. These preparations that are used also treat a condition called macular degeneration. I don't think we're doing anything with that one, though. Also, to treat bacterial or viral infections of the eye. Inflammatory conditions as well, and also symptoms of allergies related to the eye. All right. So glaucoma is a condition of the eye in which there is an increase, as I mentioned, in intraocular pressure. And what happens with this significant pressure increase is that it causes progressive atrophy, meaning it makes something smaller, right? It causes progressive atrophy of the optic nerve. Remember, the optic nerve is what the impulse is, the visual. So the visual stimuli that we receive from the environment, it is relayed back to the optic nerve, and of course the optic nerve takes that impulse, a signal, back to the brain, and then the brain interprets what you see. So this nerve, this optic nerve, it atrophies. It becomes smaller because of all this pressure, and of course the vision is going to deteriorate because of this. If left untreated, it can lead to blindness. Now, this condition is typically treated with eye drops, and surgical procedures are held off until the medications are not effective anymore. Now, the eyes lens, so the eyes have a lens, it has an iris, and also the cornea is continuously bathed and nourished by this fluid called the aqueous humor. right? It's kind of like our cells that are surrounded by blood, and the blood brings nutrients and oxygen and all these things to our cells. So, being that there's structures within the eye that are more or less avascular, it doesn't have like um, a network of blood vessels. It is the aqueous humor that actually brings nutrients and all sorts of other things that are required for healthy eyes. So anyway, so the aqueous humor is produced and or secreted, and the excess amount of fluid normally flows through. Of course, well, let me back up. So when it is produced, what is produced? There has to be a certain amount that is produced, and there has to be a certain amount that is drained. And see, when there's an imbalance and you have more that is produced than what is drained, then that's when you get the increase in intraocular pressure. Right. So again, so you have this excess fluid that normally flows out or drained out through this complex network, what we refer to as the canal of Schlemm. Right. This is the canal of Schlemm over here. Right. And this is the see, the ciliary body is what produces the aqueous humor, right? And then it drains, right? It drains into the anterior chamber of the eye, and then from the anterior chamber of the eye, it flows out through the canal of Schlemm. And that's what you want because again, you don't want this situation where the aqueous humor is being produced but yet it is not being drained, right? There has to be a balance, all right? Think about homeostasis in that sense, all right? Now, there is an angle, or an angle is formed where the canal of Schlemm and the iris meet, and that's roughly around here. That's an angle. That's the angle here, right? Think about like a triangle, right? This is actually, this appears to be open or considered open, right? So anyway, so this forms of this area. It forms a filtration angle that maintains the normal pressure within the eye by allowing that excess amount of aqueous humor to leave the anterior chamber of the eye, and it drains into the canal of Schlemm and back into the bloodstream. All right. And take a look at figure 53.3 for an example. I believe this is the example. Um, Now, just to give you an idea about aqueous humor, it is essential for maintaining eye pressure. Providing rather nutrients to the eye tissues, and it facilitates a proper light focusing. You know, the light that is in the environment, and as it enters into the eye, that fluid it helps to focus that light onto the retina. Actually, um, that fluid also acts as an insulator for the structures within the eye, and so it does protect the eye from injury. It is critical for healthy vision and the proper functioning of the eye. All right, so that's just to give you an idea about the aqueous humor. Again, it is created by the ciliary body here, and then, of course, it drains into the anterior portion, which is where it's located. It's located between the iris and the lens. But then this aqueous solution has to drain out at some point because the body is continually creating or producing more aqueous humor. Now, there are two types of glaucoma, as I mentioned, angle closure glaucoma, all right? And this is when it's essentially completely closed. You know, that angle here is completely closed. But you also have an open angle, or what is referred to as the chronic glaucoma. And there would be an opening, right? But for some reason, it is not able to drain properly. Now, open angle glaucoma is shown in the top portion of figure 53.4. So take a look at that one. Actually, while I'm at it, let's see if I can. I think I opened up my book just in case I have to show it to you. See, so it logged me out. So I'll see if it can take me back to it quickly, so I don't have to waste too much time. All right, so this is the top portion that it was referring to, right? So this is where um, this is the ciliary body that produces the aqueous humor, and of course it is draining. You see my cursor. See how it's open there? It is open, and so it drains and it flows, and then it just flows out. All right, into the bloodstream. All right. So that's the top portion that is referring to the open angle glaucoma. Now, the illustration here shows how how the angle where this aqueous humor drains is normal, right? But it does not function properly, and so because of that, an excessive amount of fluid cannot leave the anterior chamber, which is not a good thing. Now, in the angle closure glaucoma, and this is the bottom picture here, all right, you see how you got that angle of the iris. See here, it's straight, but here it bends, and it is because of that bend that this is going to create a more of a closure and not allow that aqueous solution to drain. So the iris is bent at an angle and blocks the canal, and limiting the flow of aqueous humor from the anterior chamber of the eye, so that a lot of that fluid remains in the anterior chamber. All right. Now, don't get aqueous humor mixed up with vitreous humor. Aqueous humor is what is that fluid that flows into the anterior portion of the eye, and vitreous humor is that gel-like substance that is in the posterior part of the eye. So when you know your eye's anatomy, you'll understand what I'm saying. All right. So the limitation of outflow in both types of the glaucoma, it causes essentially an accumulation of intraocular fluid, which is followed by an increase in intraocular pressure. Now, as a result, this higher intraocular pressure, the greater the risk or the higher this intraocular pressure, the more it increases because it cannot drain the aqueous solution, the greater the risk that the optic nerve is going to be damaged. And if the optic nerve is damaged, then these patients are going to lose their vision and it will result in blindness. Now, some individuals have an anatomic defect that causes the angle to be narrower than normal. So just think some congenital issues, but they don't actually have any symptoms, and they don't actually develop a glaucoma under normal situations. However, certain situations, such as medications, that causes dilation of the eye, fear, someone can have experienced fear and pain. It may precipitate an attack, right? An increase in that intraocular um, attack. And of course, the aim of the treatment in glaucoma is to lower the intraocular pressure. So take a look at the summary drug table. Selected. It's entitled Selected Ophthalmic Preparations. It provides examples of the drugs that are used for both glaucoma and other ophthalmic problems. And again, make sure you take a look at the video before you actually look at this or listen to my voiceover. I think it'll be very helpful. Let me go back to my PowerPoint here. All right. Now, as far as actions and uses for the drugs that we use to treat glaucoma, right? So the drugs used to treat ophthalmic conditions are from the same classes of drugs used in other body systems and conditions. All right, like the adrenergic beta blockers, we use it for other things, but yet we also use it for the eye as well, is what it's talking about. Now, the drugs are grouped according to their active ingredients. Systemic effects are rare. They are rare because only small amounts of these preparations may be absorbed systemically. So even though these drops may eventually end up being drained into the canal of Schlemm and into uh, the um, the circulation, if you will, the bloodstream, it doesn't really cause any systemic issues because of the small amount. All right. So one of the agents that we'll talk about initially here is the prostaglandin agonist. So the prostaglandin agonists are used to lower the intraocular pressure in those patients with open angle glaucoma, as well as ocular hypertension. Remember, because the aqueous humor is increasing in amount, it causes the pressure to increase, and so we refer to that as ocular hypertension. Now, these drugs act to lower the intraocular pressure by increasing the outflow of aqueous humor through the trabecular meshwork. That's that area that causes or that absorbs like a meshwork of capillaries, and it is what absorbs the aqueous humor and transport it, of course, to the bloodstream. And so this drug actually helps to drain that outflow through the capillaries. Now, remember I talked about the beta adrenergic blocking drugs. We talked about that with some of the other disease processes. Well, this is what it was talking about, um, where it talked about some of these drugs are used in other body systems. And so the beta adrenergic blocking drugs decrease the rate of production of aqueous humor. All right. So it decreases the production. And if it decreases the production, then you get a lower intraocular pressure. Now, these drugs may be less expensive than the prostaglandin agonists. So some places may use them more frequently for clients based on their finances. Now, then you have the alpha 2 adrenergic drugs. And so one of the drugs called the bromonidine is an alpha 2. That's one of the alpha 2 adrenergic receptor agonists used to lower the intraocular pressure in patients with the open angle glaucoma and or the ocular hypertension. Now, this drug acts to reduce the production of aqueous humor, and it also increases the outflow of aqueous humor. So it does a couple of things there. And lastly, we have the carbonic anhydrase, which is an enzyme that is found in many tissues of the body, including the eye. So inhibition of this enzyme in the eye actually decreases aqueous humor secretion. And of course, this is going to result in a decrease in intraocular pressure. These drugs are used in the treatment of elevated intraocular pressure seen in open angle glaucoma. Now, except for the drug dorazolamide and brenzolamide, carbonic anhydrase inhibitors are administered systemically. All right, this drug is administered systemically. All right. Now, another drug we use to treat glaucoma is called I believe this is Rho kinase inhibitors. In particular, is It works by acting directly on the trabecular meshwork, that group of capillaries where the aqueous humor is absorbed. So this drug works directly on this network of capillaries called the trabecular meshwork, and also it works on the Schlemm canal cells to increase their permeability. So it makes it more porous, right? It opens them up, and so that and then of course there's a decrease in the obstruction to aqueous humor outflow because you're opening it up. You're making the cells more permeable. All right. And so this will allow the aqueous humor to flow better. Now, of the drugs that are used to treat glaucoma are the miotics or direct and cholinesterase inhibitors. Remember, we talked about these drugs with other body parts, and so now, but we're making more reference to the eyes and what these drugs do. So these drugs, miotics, they contract the pupil of the eye or miosis. The constriction of the eye is referred to as miosis, and this will result in an increase in the space through which the aqueous humor flows. And of course, this would decrease the intraocular pressure. You see, remember, when the eyes dilate, that angle is more narrow, that angle that we talked about, right? And but when they're constricted, it makes more room for adequate flow of the aqueous humor. Now, the miotics were for many years the drug of choice for glaucoma. Now, these drugs are less frequently used now, and so they have lost their first choice treatment status. You have these first line, second line drugs. This was a first line drug at one time, but it has lost that status to drugs like the prostaglandin analogs, to beta adrenergic blocking drugs. Now, one of the other drugs called apracolonidine, it is a sympathomimetic drug, so it mimics the sympathetic nervous system. This is used to control or prevent post-operative elevation of the intraocular pressure. There's certain situations, especially after surgery, that can cause the intraocular pressure to increase, and so this drug helps either control or prevent this from occurring. One of those drugs is dapirolizole, and it acts by blocking the alpha adrenergic receptor in the smooth muscle, right? And it causes miosis or constriction of the pupil through an effect on the dilator muscle of the iris. So it causes the muscles of the iris to contract or constrict, rather. All right. And so again, that makes more room for the flow of the aqueous solution. The drug is used primarily after ophthalmic examinations in order to reverse the diagnostic mydriasis. Remember the mydriasis, rather, mydriasis. That's dilation of the pupils. Miosis is the constriction of the pupils, but mydriasis is the dilation of pupils. And so this drug is used just to reverse that, because sometimes we have to dilate the pupils of patients, or ophthalmologists or optometrists. They dilate the pupils in order to examine the inner structures of the eye itself. All right. Um, so drugs are used to treat infections as well as inflammation. So think about your mast cell stabilizers. Remember, we talked about that before, as well as the non-steroidal anti-inflammatory drugs or NSAIDs. So the mast cell stabilizers are used to treat itching of the eyes that is caused by allergic conjunctivitis. Now, mast cell stabilizers, what they do is they inhibit the antigen. Remember that antigen is the foreign body, that antigen induced release of inflammatory mediators. Those mediators would be the histamines, all right, from the human mast cells. And you know about what the histamines, the problems that they cause. All right, the signs and symptoms that they cause, and so that's why we give antihistamines in order to prevent these inflammatory mediators from being released and causing those really pesky symptoms that I always talk about. Now, the NSAIDs inhibit prostaglandin synthesis, thereby exerting this anti-inflammatory action. Because that's what we're trying to do. We're trying to bring about this anti-inflammatory action. Now, these drugs are used to treat post-op pain and inflammation after cataract surgery, for the relief of itching of the eyes caused by seasonal allergies, and also during eye surgery in order to prevent meiosis or constriction of the pupils. So cortisol is another drug that, well, the anti-inflammatory. These drugs possess the anti-inflammatory actions, and they're used for inflammatory conditions such as your allergic conjunctivitis, your keratitis, herpes zoster keratitis, and also inflammation of the iris. So corticosteroids also may be used after injury to the cornea or after corneal transplantation in order to prevent rejection. The antibiotics and the sulfonamides, they also, or the antibiotics possess the antibacterial action, and they are used in the treatment of eye infections. The sulfonamides possess a bacteriostatic effect against a wide range of gram-positive and gram-negative microorganisms. Now, they are used in treating conjunctivitis, corneal ulcer, and other superficial infections of the eye. The ophthalmic tetracycline, the erythromycin are also used to prevent gonorrheal ophthalmia neonatorium. In other words, gonorrhea, an infection of the newborn's eyes. Right. So they use tetracycline and erythromycin to treat that because some mothers may have gonorrhea, and of course babies have actually gone blind when the secretions from the infection make contact with their eyes, and so they treat it with their tetracycline and erythromycin. Right. Now, antiviral drugs interfere with viral reproduction by altering DNA synthesis. Right. So if I can affect the DNA, then I don't get replication of the virus. Now, these drugs are used in the treatment of herpes simplex because it is a virus, infections of the eye, also in the treatment of immunocompromised patients with what we call CMV retinitis or cytomegalovirus virus. Also for the prevention of CMV retinitis in patients who are undergoing transplantation, right? Because when these patients are placed on these anti-inflammatory or actually um, immunosuppressant drugs that will prevent rejection of organs and such, they're more susceptible to developing this cytomegalovirus. And so this medication, the antivirals, hopefully help to prevent that from occurring. We also have the antifungal drugs, natamycin, which is the only ophthalmic antifungal that is in use today. This drug possesses antifungal actions against a variety of yeast and other fungi as well. All right. And we continue with the drugs that treat infections and inflammation. So you have some of the drugs are referred to as vasoconstrictors or mydriatics. So mydriatics are drugs that dilate the pupils or mydriasis. Remember we talked about mydriasis versus meiosis. Meiosis means to constrict, and mydriasis means to dilate. All right. So this drug constricts superficial blood vessels of the sclera and decrease the formation of aqueous humor. All right. So if I constrict the blood vessels of the sclera, then there's a decreased production of aqueous humor, and of course that will, in turn, decrease the intraocular pressure. Now, these drugs are used to treat the redness of the eye and are available over the counter in pharmacies as well. Now, cycloplegic mydriatics, and think about plegia like paralysis. So psychoplegic mydriatics cause mydriasis and also cycloplegia. So it causes both. It causes both dilation and paralysis. So these patients have paralysis of the ciliary muscle, that's part of the eye, resulting in an inability to focus the eye. Now, these drugs are used in the treatment of inflammatory conditions of the iris and also the uveal tract of the eye. And for examination of the eye as well. When you don't want the eye to move very much during an examination, they can use these as well because of this paralytic action, which is one of two or so of their actions. Now, there's also a vascular endothelial growth factor receptor, or VGRF inhibitors. Some patients have what is called wet macular degeneration. It is an age related vision loss that occurs over a period of time. The vision change starts with they begin to experience distortion of vision, which leads to blurring and may present as visual hallucinations. Now, currently, there is no treatments to prevent this condition, but a number of drugs called vascular endothelial growth factor receptor, or the VEGRF inhibitors, are being used to decrease new blood capillary formation. All right, which is a leading issue in wet macular degeneration vision loss. This drug is injected directly into the fluid-filled eyeball, so they actually inject this into the eyeball. I can't even imagine that. Somebody putting a needle. They probably can numb it too. There's some anesthetic preparations out there that can help with that, I suppose, even with the eye. I know other body parts, but I would imagine with the eye as well. All right. As far as adverse reactions, so the adverse reactions for these drugs are rare. These drugs can cause visual impairments such as burning of the vision, blurring rather of the vision, and also local irritation and burning. These reactions are most often that they're self-limiting, they don't last very long, and they resolve if the client waits a few minutes. So you just have to teach the patient to be patient, right? So visual impairment that does not clear, if it doesn't clear within 30 minutes after the therapy, then this should be reported, of course, to the primary care provider because something else may be going on. All right. Some of the contraindications for using some of these drugs, of course, the hypersensitivity to drugs or any component of the drug. All right. Now, the adrenergic blocking drugs are contraindicated in those patients who have bronchial asthma or obstructive pulmonary disease. Remember, the Beta 2 receptors are responsible for causing bronchodilation or widening of the airways. But when a beta blocker blocks these receptors, they can lead to bronchoconstriction. And you don't want bronchoconstrictions or narrowing of the airways in an asthmatic or COPD patient because it can worsen their breathing difficulties if they are used. These drugs also should not be used in sinus bradycardia, heart block, cardiac failure, cardiogenic shock, as well as those who have hypersensitivity to the drugs. Think about with these cardiac conditions that were named or listed here. These adrenergic blocking drugs, they tend to already lower the heart rate anyway, lower the blood pressure anyway. And so you give it to these patients who have low heart rates, such as the bradycardia, the heart blocks, and if they have cardiogenic shock and so forth, it can exacerbate those conditions and make them worse. Now, these drugs should not be used in conditions in which pupil constriction is not desirable, such as acute iritis, inflammation of the iris, and in treatment of intraocular pressure in those with open angle glaucoma. Now, miotic drugs are contraindicated in patients with a hypersensitivity to the drug or any component of the drug, and in conditions where constriction is not desirable, such as iritis, uveitis. These are inflammations of the eye, and acute inflammatory disease of the anterior chamber of the eye. So they would be contraindicated. As far as precautions are concerned, beta adrenergic blocking drugs are pregnancy C rather. The depiprazole is pregnancy category B and are used cautiously during pregnancy and also lactation. And also clients with cardiovascular disease, diabetes, and diabetes because the drug may mask the symptoms of hypoglycemia. Also, they should be used cautiously in hypothyroidism patients because they may mask the symptoms of hyperthyroidism. These drugs tend to lower the heart rate, but remember, in hyperthyroidism, the heart rate is usually increased, and that increase would possibly alert the patient that, hey, my hyperthyroidism might be out of control, right? But they would know that because this drug that they're taking to treat their eyes might be suppressing that heart rate, and so they don't know that they're not that their hyperthyroidism is out of control, if you will, and not being managed properly. Now, the client taking beta adrenergic blocking drugs for ophthalmic reasons, they may experience an increase or additive effect effects when the drugs are administered with the oral beta adrenergic blockers. And so, what that means is these patients who take these ophthalmic medications, although they are drops, when somebody's already on a beta blocker for other, let's say, cardiac conditions, and it talks about it can cause increased or additive effects, it means it can worsen their condition. That additive effects means worsening of the condition, right? Now, co-administration, or when you give timolol, which is a beta blocker with a calcium antagonist, it may also cause the blood pressure to drop. It can result in left ventricular failure and condition disturbances within the heart. Because remember, these drugs already drops the blood pressure, the heart rate, and so forth. And so when some of these eye preparation drugs are administered, it can worsen these conditions. Now, there is a potential additive hypotensive effect when beta-adrenergic blocking ophthalmic drugs are administered with phenothiazides as well. I believe phenothiazide is a medication they use with, I want to say mental health. All right. Now, so just to give you an idea, so these drugs are used with caution in individuals with cardiovascular disease, diabetes, and hyperthyroidism. And I did list some of the reasons why. So take a look at it. Let me read the first one to you, though. As far as cardiovascular disease, so beta blockers, as we know, they slow the heart rate and they reduce the cardiac output because you're lowering the heart rate. Which now, when you do this, it can worsen someone who has heart failure because remember, in heart failure, the cardiac output is already compromised. And so you give these particular drugs, they can compromise heart failure even more by decreasing the cardiac output even more. Right. Now, these drugs can precipitate other cardiovascular issues in those with existing heart conditions as well. So we really need to know if these patients have any pre-existing heart conditions. And read the rest of the information I provided here because it'll give you an idea of why these drugs shouldn't be given together. Right. Rather than just memorizing this list, kind of get a better idea as to why. I think it'll go a long ways with your studying. Now, the drugs are used cautiously in clients with corneal abrasions, pregnancy as well. They have a pregnancy. Which one is this one? It has a pregnancy C. It's in the pregnancy C category, so it's kind of getting up there. Lactation, cardiac failure, bronchial asthma, peptic ulcer disease, hyperthyroidism, gastrointestinal spasms, urinary tract infections, Parkinson's disease, renal and hepatic impairment, recent myocardial infarction, hyper and hypotension. These drugs are also used cautiously in those with angle closure glaucoma because myotics occasionally can precipitate angle closure glaucoma by increasing the resistance to aqueous flow from the posterior to the anterior chamber. Remember, the aqueous solution is made somewhere around the posterior chamber by the ciliary body, but it drains into the anterior chamber. And it's just saying that these drugs, the myotics, can cause this angle closure glaucoma, which is essentially more acute and is a medical emergency because it can cause a significant increase in the intraocular pressure that can result in loss of vision. Let's see what else we got here. All right. Now, cholinesterase inhibitors are used cautiously in patients who have myasthenia gravis, right? Because it can cause an additive or an increased adverse effects. All right. So when we talk about additive adverse effects, it means that the effects of the drug, the cholinesterase inhibitors, may amplify, may increase the existing weakness that these patients already have, or other symptoms of myasthenia gravis, making the condition of this myasthenia gravis harder to manage or worsening the patient's overall health. Um, these drugs also should be used cautiously in patients before and after surgery, and in clients with chronic angle closure or narrow angle glaucoma. Those with anatomically narrow angles it may cause papillary block and increase the angle blockage, right? And so the aqueous humor won't be able to flow. Now, when cholinesterase inhibitors are administered with systemic anticholinesterase drugs, there is a risk for additive effects with these drugs. Also, individuals such as farmers, warehouse workers, gardeners working with carbamate, organophosphate, insecticides, or pesticides are at risk for systemic effects. Cholinesterase inhibitors from absorption of the pesticides or the insecticide through the respiratory tract or the skin. Now, individuals working with pesticides and insecticides containing this carbamate organophosphate, phosphate, and also if they're taking a cholinesterase inhibitor, they should be advised to wear respiratory masks, change of clothing, or change their clothing frequently, and wash exposed clothes thoroughly. So this is some education that we need to be thinking about doing with this population, or this group, right? Now, these drugs are used cautiously during pregnancy. Um, those who are taking epinephrine, this is a category B a drug. Rather, it's a category B pregnancy, so again cautiously, and you have to think about that benefits versus you know risk. The other drug called aproclonidine is a pregnancy category C. All right, so that gets a little worse in that instance, and so you have to be a little careful administering this drug with a pregnant person, and also in lactation. Also in clients with cardiovascular disease, depression, cerebral or coronary insufficiency, hypertension, diabetes, hypothyroidism, and also Raynaud's phenomenon. When brenmonidine is used with central nervous system depressants, such as alcohol, barbiturates, opiates, sedatives, or anesthetics, there is a risk for an additive CNS depressant effect because these drugs are supposed to, or they cause CNS depression. And so if you give them with the bromonidine, it can cause even more depression, right? Or have a more depressant, rather, effect. So use the drugs cautiously in combination with antihypertensive drugs and also cardioglycosides because of a synergistic effect may occur. When we say synergistic, it'll make it more powerful, right? Because antihypertensive drugs lowers the blood pressure and cardiac glycosides. It also has a kind of a slowing down of the heart's effect and whatnot, and they can um, together they can cause um, a greater effect, if you will, which is not good. All right. I did also provide some additional information as to why these different precautions were listed, like, for example, hypertension. The adrenergic drugs can affect blood pressure and should be used cautiously in patients with hypertension, as they may cause further increase in blood pressure or heart rate. All right. Or for example, cerebral or coronary insufficiency. These drugs can influence blood flow, and in individuals with poor circulation to the brain or the heart, um, um, such as cerebral insufficiency or CAD, they could increase the risk of ischemia, which is insufficient blood flow, which may in turn worsen the patient's condition. So just take a look at what I provided here as well. Gives you an idea of why these different disease processes are listed under precaution. Let's see. As far as interactions, drugs that are used with glaucoma drugs and how they interact. So the client taking beta adrenergic blocking drugs for ophthalmic reasons, they may experience increased or additive effects when the drugs are administered with oral beta adrenergic blockers. Now, co-administration of timolol and calcium antagonists, they can cause hypotension since that's what these drugs do. They have the ability to lower the blood pressure as it is. Can also result in left ventricular failure. and also condition disturbances within the heart itself if patient has some kind of heart condition. Now, there is a potential additive hypotensive effect when the beta adrenergic blocking ophthalmic drugs are administered with the phenothiazides. This is pretty much the same that I talked about on another one, on another one of the other slides. All right. Now, when cholinesterase inhibitors are administered with systemic anticholinesterase drugs, there is a risk for this additive effect that I was talking about. So when it is said that cholinesterase inhibitors are administered with systemic anticholinesterase drugs, um, again, there's this risk of additive effects. It means that using cholinesterase inhibitors, which are used to block the breakdown of acetylcholine, in combination with a systemic anticholinesterase drug. Those drugs that can be taken by mouth, systemic. These drugs that also inhibit the breakdown of acetylcholine. What it can lead to is an excessive amount of accumulation of acetylcholine. And so, too much is no good either. The anticholinesterase drug works by decreasing that enzyme that breaks down the acetylcholine so more is available. We want an appropriate amount available, not too much acetylcholine available. But when you give these ophthalmic preparations that has anticholinesterase inhibitor actions, it can just result in even more acetylcholine that is available, which can intensify the effects of acetylcholine. All right, and that is not good either. We actually refer to that as, I think it's cholinesterase. I'm sorry, acetylcholine something. I can't think of it right now, but basically, there's just an excessive amount of acetylcholine, and the body just doesn't react very well to that. Not too much. Now, when brimonidine is used with central nervous system depressants such as the alcohol, the barbiturates, opiates, sedatives, or anesthetics, there's a risk for additive CNS depressant effects because these drugs tend to depress. So use the drugs cautiously in combination with the antihypertensive drugs and cardiac glycosides. Again, because of the synergistic effect can occur. All right. Now, just to give you a quick definition of synergistic. So, a synergistic effect occurs when two or more drugs or substances are taken together, and their combined effect is greater than the sum of the individual effect. So, when you're putting these different drugs together, so, in other words, when you combine them together, they work in harmony to produce a stronger, more pronounced effect than if they were used alone. And so, this is not desirable for in some situations because it can make the person's, situation worse. Now, antibiotics and sulfonamide ophthalmic preparations are also contraindicated in patients with epithelial herpes, simplex keratitis, because it's a virus, right? Antibiotics and sulfonamides, those are an anti-infectives for bacteria. Also, it's contraindicated for varicella, a virus, mycobacterial infection of the eye, and fungal diseases of the eye, which we don't use antibiotics for fungal diseases as well. Now, these drugs are pregnancy B and C drugs and are used cautiously during pregnancy or lactation. Now, these drugs are contraindicated in patients with hypersensitivity to the drug, or any component of the drug. Now, the mast cell stabilizers are used cautiously in clients who wear contact lenses, Um, there's a preservative that may be absorbed by the soft contact lenses, and so that's why it would be contraindicated. NSAIDs tend to inhibit platelet formation, and so they should be used cautiously because they can cause bleeding tendencies. If you inhibit platelets, then one can will possibly rather that risk for bleeding tendencies. Now, when used topically, there's less risk of interaction with drugs or other substances. And so, because topical medications or preparations have less of a systemic effect. Now, there is a possibility of a cross sensitivity reaction when NSAIDs are administered to patients with allergies to salicylates or aspirins. And that's because salicylates and NSAIDs, they have some of the same properties or a structural makeup, and this is kind of getting into the chemical makeup of the drugs. They're similar in nature, and therefore, because they are similar, it is possible that there can be some cross sensitivity reactions or an allergic reaction. Corticosteroids and antibiotics are used cautiously in clients with sulfite sensitivity because an allergic type reaction can occur. Now, the corticosteroid ophthalmic preparations are also used cautiously in patients with infectious conditions of the eye. Remember, if somebody's taking corticosteroids, it tends to suppress the immune system. And if they already have an infection in the eye and the immune system is suppressed, it can make the infection worse. So we have to be careful. Now, prolonged use of corticosteroids may also result in elevated intraocular and optic nerve damage as well. So you have to be careful with that. All right. And folks, actually, that is it. Um, that is it. The rest of it is the pre-admission, pre-administration assessment. We'll probably get a chance to go over some of this in class, but typically you guys look after that. So um, let me stop sharing. Um, I'll go ahead and stop sharing, and I will get this to you guys and just take a look and let me know if you have any questions. Hopefully, this was helpful. Thank you. No.